In brutal second wave mortality, vaccines made all the difference. Welcome to Inventiva. I'm Oishi, Banik, back with today's news. Reaffirming the critical role of COVID vaccines in protection against death, Health Ministry data shows that in the first 7 weeks of the second wave of the pandemic, the 60-plus age group reported about 121 weekly deaths per million among the non-vaccinated, 2.6 weekly deaths per million among those who had received their first dose, and 1.76 weekly deaths per million among those who were fully vaccinated. The data for 4 months showed that vaccine efficacy in preventing deaths was 96.6% after the first dose and 97.5% after the second dose. An analysis of this granular data showed a huge difference in the absolute numbers of deaths that were reported among the unvaccinated. Between the weeks ending April 18th and May 30th, the 60 years and above age group reported an average of 121.21 weekly deaths per million among the non-vaccinated. In the same period, the 45 to 59 years age group reported an average of 39.9 weekly deaths per million among the non-vaccinated, 0.87 weekly deaths per million among those who had received their first dose, and 0.42 weekly deaths per million among those who were fully vaccinated. In the 18 to 44 years age group, there was an average of 5.6 weekly deaths per million among the non-vaccinated, 0.6 weekly deaths per million among those who had received their first dose, and 0.1 weekly deaths per million among those between the weeks ending June 6 and August 15. The 60 years and above age group reported an average of 30.04 weekly deaths per million among the non-vaccinated, 0.46 weekly deaths per million among those who had received their first dose, and 0.33 weekly deaths per million among those who were fully vaccinated. In the same period, the 45 to 59 years age group reported an average of 8.41 weekly deaths per million among the non-vaccinated, 0.11 weekly deaths per million among those who had received their first shot, and 0.10 weekly deaths per million among the fully vaccinated.